Right, we are back again with Let's Talk About Our Health and Well-Being. Thank you, Dr. Osla and Dr. Choma. We are back again. Are we happy?
Yes.
Yeah, people are so amazed with our discussion and health information we give them. They are quite happy, at least looking on the messages they send to us and the encouragement. Honestly, it is really good. You know, in life, at times people forget the most important thing, which is health, and chase less important thing in life. We should all own our health. Our health is important, and the health is wide. Health is wealth. Sorry. So today's topic, we will be discussing kidney disease. I found out that there is difference between kidney disease, chronic kidney disease, and the kidney failure. Before I wasn't aware of that. Oh my God, this is quite interesting. So we'll be discussing about kidney disease and with our amazing doctors. Dr. Choma, we will start with you. Tell our audience what is kidney disease, chronic kidney disease, CKD in short form. Because in Nigeria, I found out that recently there are so many cases among the younger people. What might be the cause? We will discuss that after, but let us understand what chronic kidney disease is.
Okay. Yeah, thank you very much. It's always a pleasure. Right, to start with kidneys. Humans, we are all born with two kidneys.
Okay.
Yeah. And some people have only one. That's not a problem. And what does the kidney do? It filters the waste product from our blood, and therefore removing those waste products and also helping to maintain hormone, and particularly hormone related with red blood cell function, so that we don't become anemic, and also maintaining our bone health by manufacturing the ingredients for vitamin D.
Okay.
So these are all the things the kidneys do. And so when you say chronic kidney disease, so the kidneys will function, we have to measure it in number just to keep it simple. Normal kidney function will be when you talk about your estimated glomerular filtration rate, EGFR. So 90 or above is considered normal. You have normal working kidneys. Then when you talk about chronic kidney disease, it means that the kidneys aren't working as well as they should.
Okay.
Yeah. And then you have them to put it in stages. It goes from stage 1 to stage 5.
Okay.
So normal kidneys is the EGFR of 90 and above.
Okay.
And what that means when you check the person's urine,
Okay.
it's just urine. There should be no blood, and there should be no protein in the urine. Now, in chronic kidney disease stage 1, the EGFR will be about 90, but there will be some degree of protein or blood in the urine. So that means that the kidneys is not doing the job properly.
All right.
Because the kidneys remove waste product, which is mainly urea, as urea in the urine, but there should be no protein and blood in the urine. So when you dip the urine and there is a bit of protein and a bit of blood, but the kidney, the EGFR that you mentioned is still 90, then that is stage 1 chronic kidney disease.
But Doc, sorry for cutting you off. Is there a way we can bring this down to the lowest level for people to understand? Maybe like you said, GFR.
EGFR.
Okay.
This
EGFR.
is the terms that we use to measure. So say if you want to measure length, you measure it in meters and centimeters.
Okay.
Yeah, or inches. Yeah. When you measure kidney function, we measure the glomerular filtration rate. This is the bits of the kidneys that's actually filtering the blood and removing the waste product. And that's the level we look at. Similar to when we measure blood pressure. You measure it in millimeters of mercury, and then you would say the person's blood pressure is 100 millimeters of mercury. So when you talk about kidneys, you talk about the estimated glomerular filtration rate, and that is a range of between 0 to more than 90. So anything 90 and above is normal. provided when you dip the person's urine, there is no protein, there is no blood. So that would be considered a normal functioning kidneys. Then in chronic kidney disease, that number starts to drop, and then you would start getting the proteins and the blood, or sometimes even glucose in the urine.
Wow. But like high blood pressure, is it this type of measurement, is it something that one can do on his own, or it's something that doctor?
Yeah, it's not the thing you can do on your own, because it's done by blood tests. It's measured, the glomerular filtration rate is measured by doing a blood test. So you give a blood sample in the lab, and then they look at what is the EGFR. And also in the urine, to measure, to check for the protein and the blood. It's not visible blood. Usually it's not visible blood, because if you see visible blood in your urine, you know there is something wrong. But in terms of kidney disease, it's usually blood that is not visible to the naked eye. But when you do the urine test with the special sticks, then it picks up that yes, there is blood, or there is protein, or there is glucose in the urine, and there should not be any there. And then you have to quantify from the blood test what is the level of that kidney disease, which goes from level 1, which is very mild. You can still do a lot, you still lead a normal life. Often you have no symptom, but then you've got to then look at what is causing it. So it will range from stage 1, which is the kidneys is still working, but not as good as it should. And then you have stage 2, which the EGFR is dropping some more, and you're having more protein in the urine. And then you have stage 3. So a lot of people between stage 1 and stage 3, often you have no symptom, but at that stage it's important to then find out what is causing it and what can be done about it. And that's where you need your doctor. So that most of the time it's your family doctor that will manage that stage of that chronic kidney disease. Stage 4 to stage 5 is a bit more serious. That's where often one would need help from a kidney specialist.
Wow. Doc, please, we have to, because there are a lot to discuss in this. There are a lot to discuss regarding to this kidney disease, and I believe we will take it gradual by
step by step.
Step by step. In Italian language, we say piano, piano. So, oh my God. So, Dr. Ursula, we come to you now. Like Dr. Choma told us about what this chronic kidney disease is. Are there different types of chronic kidney disease? Are there different types?
In a way, yes, because it depends on what caused it in the first place.
Okay.
And I would believe that there's been an acute before you get to a chronic.
Right.
And it's the duration basically that by the time it's known, it's progressed down the line, and it then earns that title of chronic kidney disease, really. So most of it would have started as an acute event. And there are some conditions actually that may run in families. And if it's not picked up early and managed, then it progresses without you knowing. And in the journey towards that progression, all you might be having is a bit of tiredness here and there, and a bit of headache, not realizing that you're hypertensive, and it's hitting on the kidneys. Okay. And there are some specific ones as well that really starts in children, at birth. You may have an abnormality that you're born with. Most people are born with one kidney. It's entirely compatible with life, but you're not aware. If you're not investigated, you will not know that you have just one kidney. You may have an abnormality in that one kidney.
Wow.
And over time, because that's essentially what will happen, as Chinwe said, the kidney filters waste from the body. So when that waste accumulates over time, you begin to get the back effect of the waste accumulating over time. And that is what is the chronic kidney disease. Chinwe has kindly talked about the stages and EGFR. I think EGFR is done more here. But back home in Nigeria, I don't think they do EGFR. I think what you get more is they talk about stage 1 kidney failure, stage 2 kidney failure, stage 3 kidney failure, and that they align with the urea and the creatinine and the symptoms the person is presenting with at the time. I believe that for a good majority, and even in this part of the world, problems tend to start in infancy. All these temperatures babies have, and toddlers and infants, and into childhood that people have, and it's treated as malaria. 99% of the times it might be malaria, but it might also be a urinary tract infection. And the thing with, I'll use this acronym UTI, right? I'm using a very long word, urinary tract infection. The thing with the UTIs is, if it's just that the infection affects just around the bladder and the urethra, that's fine. But if you're having that infected urine moving from the bladder, going up the ureters, going into the bladder, into the kidneys, then that tends to damage the kidney. And the thing with an infection is that the infected urine with the organisms that you have in the urine, there are different layers in the kidney, okay? And if it gets to the outer surface of the kidney, it tends to damage it, leading to scar formation. And it depends on how damaged the kidney is at that time. But if you're having recurrent UTIs and it's going down the same process, damaging, giving you that scar formation, or having pyelonephritis, which is an infection of the kidney itself, it means that over time the kidney keeps getting infected and small and small and small and smaller. And there are hormones as well produced in the kidneys that helps in red cell production is one. Helps with the 3 layers of the kidney, the blood pressure, the water metabolism is being maintained by that. There are hormones that help in blood pressure regulation as well, that you have there. And you can imagine if you're having recurrent infections there, knocking on it, the kidney gets smaller and smaller over time. But the body is quite good that the other kidney will try to compensate and get bigger and bigger and bigger. Okay. And for majority in this part of the world, common cause of chronic liver failure is pyelonephritis and UTIs in childhood. And then it will manifest much later in adulthood. Okay. And that's in addition to other things that is actually well established, that if it's not well managed, the long-term consequences includes chronic kidney problems. Okay, one of it is diabetes. That's a well-known complication of diabetes. You end up with chronic kidney disease alongside other things with the eyes and nerves and such like. And then you have hypertension, which is a silent killer. And you made reference to young ones having kidney disease and stuff like that. Most might be secondary to hypertension. Because our practice back home is, you never quite realize that if you're hypertensive, you're in for the long haul, essentially. It's not a case of just buying one sachet for 2 weeks, and once you're done with the sachet of 14 tablets, you think you're done and dusted. You're not. You're in there for the long haul. And if you're not doing that in the long haul, then what happens is, you can imagine chronically hypertension, you're up there. the back pressure, it keeps knocking on all the systems, not just the kidney. It keeps knocking on the systems, and when the system cannot cope, like at the kidney, and as Chioma just said, you find yourself moving from stage 1, maybe to would know, stage 2, stage 3. I've known people that actually suddenly found out that they even had a problem when the EGFR was 9.
Oh my God.
And they were still walking around the streets.
Mm.
And just by chance had the opportunity to have a proper blood test and had an EGFR of 9.
Wow.
So it's difficult. It's a case of raising that awareness for people to know things that can cause kidney disease. It's not just chronic. It's realizing early that this, if not well managed, can result in the long term in losing the kidneys and possible death.
Wow. Like, there is something you said, I wasn't aware. Somebody I knew was telling me that found out at even adult age that she has one kidney, that she was, but I was just like, how come?
But
here in the UK,
no,
you said,
you won't know until you have a scan for whatever reason.
I was like, are you sure?
Except something led to a scan and they find one kidney. You will know.
I mean,
There's absolutely no reason.
I suppose I'm not sure, because you think about most of the population.
Yeah.
What sort of care do they get antenatally? What sort of detailed antenatal scan do they have to look at make sure that how is this fetus forming? Does there anything look wrong with the shape of the heart? Does anything look wrong with the intestines or any of the other abdominal organs? Does the bone look alright? These are all the scans that it's necessary in antenatal. Often it's picked up if the person has got one kidney. Over in the Western world,
yes.
In the Western world, it's picked up that yes, this baby have got one kidney, and therefore care is provided from start. But then, however,
I don't think you have these detailed that normally scan at 20 weeks, but I've known instances even with the detailed scan. So it's not all
very few
here, so to speak. But an effort is made to look into things like, because prevention is better than cure, so that you can begin to prevent. But I've known of instances as well that this person will come and scan and say, I don't think I saw 2 kidneys. The other person will come and scan and say, I saw 1 kidney. The other person, so it just keeps toing and froing. But the good thing about it is that after birth, you will then have a proper ultrasound. And I believe with such things there are massive limitations back home as to what you can do and what you can do. And it's all monetarily driven that will make people not to do it.
Wow. But having said that, even if you have one kidney, and provided it's a healthy kidney, life goes on. You can lead a full life with just one kidney. It's the things that then potentially could happen, like the undiagnosed hypertension, undiagnosed diabetes, these repeated infections that you keep treating yourself as malaria, not knowing that it's something different. These are the things that will ultimately then knock off that single kidney, and there you go, kidney failure without knowing.
Wow. Because when she said it, I was like, how can such thing happen?
Yes, you can live the normal life with one kidney, yes, provided there is nothing else going on.
Wow. It just made me to understand that life, it doesn't matter how you look outside. It's when we talk about health is what your system inside. How are the systems performing inside your body? We really need to take care of ourselves through what we eat, through what we put in our mouth, because
and making the effort to have a checkup. Well, at least once a year, have a proper checkup.
And they always complain, where is money?
And another thing is,
it depends on your priorities. Because as soon as you suggest, go for regular checkups and all whatnot, we don't have money. But then you have money to buy a shaving. It's just your priority, really. People don't kind of value life. But you're more interested in all these artificial surface things. Buy endless achievements that you buy and
the hair,
the hair, the eyes, the nails.
That's the new thing. Eyes, lashes, and nails.
We all need to own our health because health is very, very important. If you've not seen people that are struggling with your health, with their health, honestly, you will thank God for being healthy. Health is important, and we are doing this not necessarily for us, for everybody, just to add value, to let people understand how important it is to live a healthy life. Honestly, you can, if you are healthy, you have everything. You have everything. Take ownership of your health. Health is money, more than even money. So, Doc, let us continue with our discussion. Dr. Chinwe, can you tell us when we say that one has a kidney failure? Because from what you have already started it, saying different how this kidney disease displays. So, when do we say actually that this is a kidney failure?
Yeah. So that will be the stage where probably most people, majority of people, I suppose, back home, without realizing that they have got this chronic kidney disease, and unknowingly it's progressed to the point where the kidneys have lost all function. So all those waste products that should be filtered in the urine is all sloshing around within the blood. And to the point, it was at some point the person might even stop producing any urine.
Wow.
So all function of the kidney is gone. But at that stage, the person would be unwell. They will have quite a number of symptoms: lethargy, fatigue, lack of energy, looking anemia perhaps, and retaining fluids. Where you look at them, you see that their ankles, their legs all look swollen, and their color loses that our rich brown bronze color. They look ashy sort of complexion because of the anemia. And at that muscle aches, you feel them, they are always complaining of joint aches and muscle aches. And so, but at that stage, the kidney has just lost all the function. So all the waste products, particularly the creatinine, the urine, the urea that should be filtered, because it is a waste product, it's of no use to the body, it remains within the person's system. At that stage, that's when you classify it as kidney failure, because the kidney have lost all ability.
So we are talking about the two kidneys now.
Yes. It would have been, it would be difficult to have kidney failure if one kidney is still functioning, because that one kidney can compensate.
Okay.
That stage will be kidney disease, because one kidney may have lost function, but the other kidney would be able to compensate. But if unfortunately it's one of those people that have got only one kidney, so if that one kidney loses the function, then that would be kidney failure. And in terms of the blood test, if you're measuring it from the blood test, that would be anything EGFR of less than 15? 15. Less than 15, 1-5. Less than that would be the kidney failure.
Wow. Dr. Fla, do you have anything to add in this?
No, Chama has covered it really. It's just the awareness should be there to manage preventable things well and early, because once it's done early, you stop the progression. And in terms of numbers and knowing where you are in that kidney failure journey has to come from the lab and your doctor, because it's not a number you will know if you don't run the test. And once you know that number, and let's assume that you've been told you're in stage 3 kidney failure, as they tend to use back home, a good management of blood pressure in particular, absolute management of it can stem the progression. So it's not a case of I think there's this rush in our people most times, and it's happened to close family member as well. The urea, because you do the blood test, there are so many parameters you look at, and each lab has a reference range, depending on the method they use. So the method in this lab here might not be the method in that lab here.
Yeah.
It depends on what reagents and what they use. So they would have a reference range of what is normal for them. And within that reference range of what is normal, the key things most times I might start pointing towards there might be an issue with the kidney before you go down the path of having your ultrasound and such like, is there's this urea. Okay, you have your potassium, you have your sodium. Okay, they might give an indication as to what's happening if the numbers are abnormal, and if the numbers are abnormal, it's then on the doctor to try to find out what's wrong, why is it off. Because if you can identify why those numbers are abnormal, you may control the progression of proper kidney failure and the dialysis that will go with it. And I must admit this as well. I think the professionals back home don't do very well, because it looks like from the few interactions I've had, dialysis is pushed more to the fore. Okay?
Yeah.
Stage 5 in particular, the kidneys are unable to filter urine. They cannot. Okay? And when the kidney cannot filter urine, the waste in the body accumulates. And what then accumulates is that the urea will rise so much. The creatinine, which is essentially made in the kidney, and they're made in some muscles as well. And these two are markers of an issue with the kidney, as well as the potassium. Sodium drops over time. But if you're having the urea extremely high, creatinine very high, issues with the potassium, issues with the sodium, you are looking so sallow, as they describe it in the books. There's this dusky, dirty, grey kind of complexion that you have. The erythropoietin is produced somewhere in the kidney, and if the kidney is failing, it cannot produce that. Therefore, you cannot make blood cells. And if you're anemic, what happens? You're tired. You're tired. The protein is impacted on poor. The muscles are weak. Because the body is not releasing the waste, there's accumulation of fluid. So therefore, you have swelling of the legs. And depending on how advanced and severe that swelling is, it extends further up. Okay? And sometimes you have general body swelling. And don't forget, the way the body works, they are interlinked. So that if there's this chronicity in the kidney, it begins to backflow. And it makes its way all the way back up. So you're not just talking about the kidneys now. Over time, it pumps back up, the heart is affected.
Oh my God.
Okay? And if the heart is affected, it's going that way to the liver, it's going that way to the lungs.
Oh.
And the key to all that is identify it early, the things you can prevent. And most times it's all down to, if you're unfortunate you have a tumor, that makes it easy actually, because if you chop off the tumor, that's fine.
Yeah.
But when it's something like hypertension that is affecting the whole of you, diabetes, and that diabetes to give you chronic liver failure just means you've been off your hookah for a long time. Your diabetes has been poorly controlled. Because what's out there in the literature as at this time is that you must have poorly controlled diabetes for onwards of 10 years to begin to have, your eyes will go first, the kidneys will go, before the nerves will go. And that's how they go. So one would have been ignorantly negligent to an extent to begin to manifest all that. And the key thing there for everybody is our health is our wealth. It's not the Ashebio. It's not the 1 million gold on your neck. Those ones are just, it makes you feel happy in your life. But your life...
Look, I'm having palpitation.
No, it's true. It's just because people back home... people back home attach importance.
Oh my God.
You just come, you're doing like this. You're doing like this. But your blood pressure is 240 over 150. Bloody hell. Where that thing, what is it? Piece of metal. But that is what gives us joy. You feel important that people like me don't even recognize the difference. So you might actually think you wear something of 1 million. I just look at you and laugh because I didn't even know the difference. I don't know what it is. I don't know the value. But you're just feeling so tough in yourself. The key thing there is life is wealth.
Yeah.
And we should pay attention to our life and our health.
Okay.